Welcome to the question number 109803 of the question bank of UWOLRD. The case presented in the question has fever, tachypnea, tachycardia, and productive cough. These are all signs of infection. Pleuritic chest pain happened due to pleural effusion. Pneumonia, a lot of time, is combined with pleural effusion. There is dullness to percussion and bronchial press sounds on the left side. These are signs of consolidation. These signs, the first four points, refer to pneumonia. Diabetes mellitus and smoking and alcoholism are risk factors for developing pneumonia. Weakened immunity in diabetes leads to more prone to infection, makes the patient more prone to infections. When we change the position of the patient from the right side to the left side, the saturation dropped from 94% to 89%. So, right side is a healthy side, the left side is a diseased side. When he slept on his diseased side, the saturation dropped. What caused this? Something called shunting of blood by gravity. In the answers, it's called intrapulmonary shunting. It's the same idea, it's the same thing, but with different wording, different phrasing. You have to understand the idea. If you are sleeping on your right side, there is more blood going to the right side. If you are sleeping on the left side, there is more blood going to your left side. Why does that happen? Because of gravity. Gravity makes blood go onto the lung, more into the lung that you are sleeping on. When you are sleeping on your right side, you are sleeping on the good lung, more perfusion, so the situation is good. When you sleep on your left lung, the diseased lung, so more perfusion to the bad lung, so less saturation, more wasted perfusion. The remaining choices, like dead space ventilation, you have just to understand what everything means to exclude them. Dead space ventilation means ventilation with no gas exchange. Like in pneumonia, there is no ventilation with no gas exchange. There is no ventilation at all. Like these alveoli are not ventilated. Minute ventilation is related to tidal volume and respiratory rate. Respiratory rate is increased and tidal volume, it remains the same almost. Like the sum of the minute ventilation remains the same. Like the respiratory rate can increase and tidal volume decrease a little bit, so it remains the same. Or somehow, like less or more. Effort-dependent hypoventilation means that there is hypoventilation due to effort to change. Like you change the effort. You decrease your effort. Why would you decrease your effort? In cases of pleural effusion, there is a pleuritic chest pain. It happens in this case. It might trick you, but the thing is, the respiratory rate is increased. It's not decreased. If there is an effort-dependent hypoventilation, if you decrease your effort to ventilate and hypoventilation ensued, this requires you to decrease your respiratory rate, and this is not happening in the case. Hypoxic vasoconstriction, it happens, although it happens in pneumonia, but it's not positional. What does that mean? Like there is a hypoxic vasoconstriction that happens in the consolidated lung because lung wants more blood flow into the more ventilated areas, and in the pneumonic part there is less ventilation, so the vessels will constrict to divert the blood into the healthy lung. It happens, but it's not positional. It is not dependent on which side you are sleeping upon. It happens either ways. Last thing, oxygen fraction in air is constant, like it's 0.21. It's like 21% of air that we breathe on Earth is oxygen. Okay? And this fraction remains constant, except in high altitudes where it decreases. Otherwise, it remains constant. There's no change in it. And that concludes the video on this question. If you have any questions, do not hesitate to leave it in the comment section. Thank you.